Hey guys, Dr. Steve Wiseth, your TRF chiropractor, helping you take your health, of course, to the next level. And what I want to share with you today is spinal degeneration. What is that and what does it mean? Well, of course, we're talking about the spine because that's what we treat here in the office. We want to make sure that your spine works properly so you can take your health to the next level. But if you're not getting adjusted, what happens is sometimes that spine, if we neglect it, it can deteriorate or degenerate into, of course, spinal degeneration. And what I want to share with you is, of course, these x-rays here, but then also I have models here, of course, what spinal degeneration actually looks like as well. So let's take a look at this. Of course, textbook normal here, okay? What we have is very nice, graceful forward curve in the neck here. What we have is there's equal disc spacing. Those discs are kind of spacers for the nerves so that those nerves can flow right to all the proper nerves and organs and muscles and tissues. But then, of course, if we have a neck like this, there's proper and normal turning and bending. And that's exactly what we want to see with you and your family. Now, of course, if we have spinal dysfunction, that can lead to phase 1 degeneration. What I mean by that is, look, there's loss of the curve. Of course, there's narrowing of these disc spaces. And of course, along with that, some of those symptoms are impaired turning and bending. Those things are going to be locking up. They're not going to be working right. And of course, if you ignore the symptoms, if you ignore these signs, things can deteriorate into phase 2 degeneration. Now, with phase 2 degeneration, there's really roughening of these joint surfaces. There's bone spurs that start to happen there. Of course, what that does is it really reduces your mobility. And of course, if we neglect things, which I don't recommend, things can deteriorate and degenerate into phase 3 degeneration. This is bad because in phase 3 degeneration, there's severe bone remodeling. There's some serious bone spurs there. And of course, there can be permanent loss of function. Of course, if we don't do anything, it can go off the map here into phase 4 where you have to have something like surgery or something more serious like that. Hey, look, once again, guys, you know, here as a chiropractor in the office, what we specialize in is, of course, the spine. And what we want to make sure is that your spine is moving properly so that it doesn't, of course, degenerate. Now, what does your spine look like? Well, if you're a patient here in our office, of course, you know exactly what your spine looks like because we have the nicest digital x-ray machine in the area. But the other thing too is this: if you want to know, or if you know anybody else who's hurting and they have impaired turning and bending, or things are locking up, or they have pain going down their arms or legs, or any of these main symptoms, okay, maybe they have their spine that's degenerating a little bit too. And what we want to do is we just want to see if we can help. That's right, we want to see if chiropractic is right for you. And to tell you what, consultations are always free here in the office, so if you or you know anybody else that's hurting, just come in and get checked, okay? Once again, guys, I'm Dr. Steve Wiseth, your TRF chiropractor, helping you take your health, of course, to the next level.